so much evidence now to show that exercise should be the first drug that we prescribe for breast cancer. And rather than boring you with a load of PowerPoints that you will never look at, what I'm going to do is in the next week get a list of all the evidence that I can send to you so you've got it to look at on your own time. What I want to do today is just go through some of the really powerful points, the keynotes of the major trials, and what some of the barriers are to getting everybody exercising. Now, you may think I'm some superhero. The triathlon I did during chemo was a very slow sprint pace one. It took me 2 hours. I was stopping every half a length to do breaststroke in the pool. No one told me to exercise, and that was 10 years ago. And I know now a lot of people aren't being told to exercise. Doctors like me don't get training in telling healthy people to exercise, let alone people going through chemotherapy, through surgery, who have other health problems. We're scared. A lot of the advice we give is made up on what we think is safe. And if we don't exercise, we don't get it. We've never had chemotherapy. We can't imagine anyone exercising during chemo. You must be mad. But it is possible. And the world is slowly, slowly changing. And I'm off to Boston next week for the International Society of Exercise Oncology to try and get the message out there. But as I said, exercise should be the first thing we get patients to do. There is so much evidence to show that with prehabilitation, from the day you get your results and you are waiting 2 to 4 weeks to have surgery, regular exercise can reduce the risk of infection. It can get people out of hospital quicker. It can help with their recovery. When women and men are going through chemotherapy, they should continue to exercise. And I've got a list here. There are 7 things that exercising during chemotherapy and radiotherapy can do. It has been scientifically proven to improve fatigue, anxiety, depression, quality of life, physical function, sleep, as well as bone health. Exercising during chemotherapy can have a huge impact on the side effects that people feel. And I swear, just walking for half an hour every day and going to the gym, doing simple bodyweight exercises on my good weeks made a massive difference to how bad I felt. But the huge thing is that regular exercise can reduce the risk of recurrence by 30%. 30. That is huge. We give chemotherapy if there's at least a 5% benefit. So we give 100 women chemo, 5 of them will still be alive in 10 years because of chemo. The other 95 won't. Exercise, a third of them will still be alive. We give tamoxifen to reduce the risk of recurrence, and that benefit. No, it doesn't work with everybody. And I've had chemotherapy and radiotherapy and surgery, and cancer's a sneaky little bugger and it can still come back. So we can't be bad biology. But if you take women as a whole, tamoxifen can reduce your risk of recurrence by 10, 15, 20%. Exercise can reduce it by 30%. And it's free. You just need a pair of trainers. There are no side effects. It's been shown that for people with metastatic breast cancer, exercise is safe as long as prescribed by someone who's had the CAN rehab training, who knows what they can and can't do. It is the best thing they can do for the bone health. But nobody is talking about it. In my own trust, there are surgeons who do the park run every week who will not tell patients about 5K your way because they say, my patients are happy with what we offer them. And I know they're not being offered things. And I spend a lot of time trying to get the information out there online. And it's really, really hard because cancer exercise doesn't have a big social media following. It's not out there. It's not sexy. It's not exciting. And when we're not making that buzz, it's really, really, really hard to cut through. And a lot of patients ask, yeah, but why do I need to exercise? How does it actually work? And it's like, despite knowing that exercise is good for our hearts and our bones and our mental health, they want to know at a mitochondrial level exactly how does exercise stop you getting the cancer coming back. We don't know yet. We just have trials that have looked at tens of thousands of patients. And I've just got some of the data here, I'm going to say. They found that people who met the guidelines for physical activity, and you're going to hear what they are, had a lower chance of dying from anything and a lower chance of dying from breast cancer. They were less likely to have side effects. They had better fatigue. They had a better quality of life. They were less likely to develop lymphedema. They was less likely to go on to get frozen shoulders because shoulder problems are a huge issue after breast cancer surgery. It should be something that everybody is told to do for the rest of their life, and we're just not doing it. And that's where hubs like this are incredible to try and get this message out there. Exercise is safe. In my dream world, every single person who saw a breast cancer patient on their journey would tell them to exercise. What exercise have you done today? But it's hard because I'm going to put my hand up. I've done no exercise for 2 weeks. I'm in the middle of a tight book deadline, and I am very good at finding ways to say, I don't have the time. I can't go for a run. We all have good and bad days. And a lot of doctors and healthcare professionals aren't exercising regularly. It is hard to find the time to do 3 aerobic sessions a week, especially when they're meant to get your heart rate up and feel sweaty, and to do the resistance training. And we've all got other lives going on. You know, there are single mums having chemo, and it's like, I don't have the time to go to the gym, you're joking. And it's how you can find ways to break resistance training down into snacks. So you do your squats when you're on the toilet, or push-ups against the kitchen counter. If you need to take the washing upstairs, can you do it sock by sock? So you're getting your exercise in, and try and find easier ways to help people do this, like the Her Spirit apps, the park runs, that community of feeling you're letting people down if you don't do it. It is so, so, so important. And I really think that what you are doing is fantastic to try and get this evidence out there. There are no downsides to exercising during cancer treatment. It's just healthcare professionals are scared about prescribing it because we don't know what to say. And patients are scared to do it because they think it might hurt them, or they're told it's not safe. And I'm hoping after the end of this, we can all go out and say, right, let's get exercising. What are you going to do? Find something you love, because it's not about all of the benefits that we've seen. For a lot of people, when you are exercising, it's just that mindfulness. When I'm running, I'm just Liz. I forget I've had cancer, and the beauty of being able to get out of that cancer headspace for a while is just amazing. And I can't wait to hear what the fellow patients we've got are going to say about their experiences with exercise. And I'll stop there.